Local doctors warn the pandemic caused smokers to increase their habit. Smoking is the #1 cause of lung cancer. Healthcare professionals in the Quad Cities urge people to learn more about the deadly form of cancer and what they can do to prevent it. Local 4 Sierra Krug joins us live in the newsroom with that. Sierra.
Yes, Jim, a doctor with Genesis Health System who specializes in lung treatment told me stress and idleness, both characteristics of the COVID-19 pandemic, can cause smokers to rely more heavily on their cigarettes and e-cigarettes. This has these health professionals worried as an increase in smoking throughout the community could directly lead to an increase in lung cancer.
Is the most deadliest cancer.
A concern local medical professionals say needs more attention as we enter November Lung Cancer Awareness Month.
Iowa and Illinois are higher as states go for our deaths from lung cancer.
Over 80 to 90% of all cases of lung cancer starts with smoking.
The pandemic contributing to a surge in cigarette usage.
The stress of isolation, the stress of trying to work in a different environment, and I think unfortunately, lots of idle time as well. So certainly we've seen people probably smoke more than they should. And also cigarette sales have increased some. I think people are stocking up, just like to stock up on every other staple.
And making it harder for smokers to quit.
Because of the pandemic, people are also delaying routine health care as well, and maybe, unfortunately, delaying diagnosis.
Quarantine making secondhand smoke more of a risk than before.
If you're in an enclosed environment, that air gets recirculated and you're just breathing that in passively.
Your risk is 30% for lung cancer for a non-smoker. So if you're in a household with smokers but you don't smoke, ugh.
With COVID now, we understand the importance of air circulation and how to get fresh air in.
COVID itself increasing the dangers of the already deadly cancer.
COVID causes a significant amount of lung damage, and by smoking, you're actually inhibiting some of the natural defenses in the lungs. Having lung cancer puts you at a very immunocompromised state, either diagnosed or under treatment, and certainly it puts you at greater risk of not being able to fight off COVID.
Representatives from both Genesis Health System and Unity Point Trinity say early detection via screening is the best way to combat lung cancer. We have information on upcoming screening opportunities with both health systems on ourquadcities.com. In the newsroom, Sierra Krug, Local 4 News.
Sierra, thank you.
All right.